So we're here today to talk about a hygiene plan recharge. And this is an area in valuation which can make or break a practice valuation and the profitability associated with your plan list. There's different ways of doing it. And in a large number of cases, principal dentists just don't do a plan recharge. And when you explain it to them, they soon realize that they've both been paying the associate dentist a percentage of the plan, and they've been paying the hygienist to deliver an element of that plan. So there's various different ways of doing it. So first of all, let's dive into, I guess, the different ways of recharging a dentist.
Yeah, I think when it comes to recharging a dentist is to try and make it as simple and as straightforward as possible. Like Phil already alluded to, it's one of those things that can be overlooked and can be overcomplicated when it shouldn't need to be.
Yeah.
One of the easiest and straightforward ways that a lot of practices look to do that is via an hourly recharge for their hygienists. But what we've seen from a plan perspective more increasingly is that people are trying to make it more straightforward and look at stripping out the two elements. So with the majority of practices now leaning more towards maintenance plans, the most popular route that we see is that you pay your dentist for their exams and then you pay your hygienist for their hygiene fees.
Yeah, that's definitely the most simplest. So you're basically effectively paying the dentist as if that was a fee per item patient. So if their plan is 2 checkups and 2 hygienists, the dentist at the end of every month, you'd simply calculate how many plan exams they've done, you'd times that by your, I guess, the regular exam fee, and then you'd give them their percentage. And then there's no need for a recharge because you're paying them independently for that element and you're paying your hygienist on a percentage or an hourly rate. That becomes the most profitable way to effectively run and manage a plan, because then the practice retains all of the monthly income that's being received and the practice benefits from any patients that don't come in to the practice. Any of that 10 to 20% of patients that don't come for their regular exams, the practice receives their monthly income without having to pay the dentist the associate fee. So that's certainly the strongest way to manage a plan, and it avoids any complexity. But you mentioned then recharging the hourly rate. So that's simply just calculating how many hours the dentists have referred their plan patients to the hygienist and recharging them for their time on a cost neutral basis. So again, if they've used 10 hours of hygiene, you would do 10 hours times the hourly rate, and that will come off their pay statement as a cost neutral position. I guess the only other way that some places do it is a per patient rate, don't they, on the plan?
It is something that they can consider, but it's not something, to be honest, that we see as frequently used.
Yeah, it's a complex way of doing it. When you give them, typically from memory, it's £3.50 per patient per month, and they just pay a set amount for almost looking after them patients, and that takes into account the hygiene recharge, so you don't have to do that. But as you said, I think the easiest thing to do is to make it as simply as possible, with the caveat that this only really, the per patient rate and the exam charging per exam, it's only really applicable to the maintenance. So if you have got a care plan in place of which you're paying the dentist 45 or 50% of the care amount because they're doing all of the treatments, you do need to do a recharge for the hygienist, because if you don't do that, then you will be double paying and you can't treat it the same as you can in exam.
Yeah, it's exactly that. And I think with the recharge as well, it's one of those things, especially from your associate's perspective, obviously it's an additional cost for them to take into consideration, but to keep the encouragement to refer into the hygienist means that it does free up your clinician's time to focus on other forms of treatment as well. So it does work well on both sides of the coin.
Yeah, and a lot of the time it's just explaining to the dentists how it works, because if you don't explain it, and they're not used to a recharge or a different way of working, it's really hard to get your head around it. But effectively, if you don't have a recharge and you're paying your dentist 45 or 50% of the net income being attributed to the practice, then you are double paying, because you're paying 50% or 45% plus a percentage of, let's say, 35 for every hygiene appointment or an hourly rate. And that leaves your profit margin on dem planning. And we've seen it as low as 15% on the basis of that not being implemented, and that has a massive detrimental impact. Now, some people will say, well, the buyer can change that it's really difficult, isn't it, as a buyer to go in and make that change.
Yeah, I think if you're somebody new that's coming into the business as well, I think everyone knows that it's key to keep continuity and stability within your business as well. So to come in straight away and have to enforce those types of changes is always going to create some form of unrest. So to get it right and set up for the new owner occupier coming into the business is always going to add value.
Yeah, and it needs to be done beforehand to benefit on that modelling within the valuation and that profitability, which effectively we base the value on. So there you go, plan recharge and dealing with plan. Make sure you have it in place beforehand. We're happy to help and happy to model various different ways to see what impact that has on profitability, but it's something that can make or break that plan profitability, and you need to get it right.